Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, Orko Mukherjee, your IT manager, and a good news to all the viewers. I guess we have just crossed that hustle, the tussle of technical glitches with the auto e-participation certificate, auto-generated e-participation certificate. You can just go in the link given below, and then just do everything you want. Just go through that and go through over there, and you can just get the link of today's CME. If you still have any problem, just do email us. The email will be given at the means given after you fill up the registration certificate. So without wasting any more time, let's just jump into our 30 seconds countdown time.
Good evening, everybody. Good evening, sir.
Good evening, all of you.
And we wish all viewers across the globe a happy Vaishakhi and happy New Year for several states of our versatile country, India. And now we are steadily going on to the 114th episode of continued medical education. Orko had given a very good news for reissuing of the e-participation certificates, which is a required setup for all the practicing homeopaths across the country. So that's a very important thing we had missed in last 3 episodes due to certain technical glitches. And with your kind permission, respected sir, let us call on the inaugurator tonight, brilliant scholar. Sir, with your permission, please.
Please call Dr. Parvez.
Dr. Parvez Ahmed Khan, who has been a brilliant scholar in UG and PG, both from NIH, and a successful homeopathic practitioner, and doing several successful treatment and documented cases he is keeping. He will be the inaugurator tonight. I request Dr. Orko Mukherjee to bring Dr. Parvez Ahmed Khan on screen.
Hello everyone. Can you hear me?
Yeah, you're audible.
Yes, audible. Yeah.
Right.
Okay. Yeah. Good afternoon, everyone. Thank you, Bidyut. Thank you, Kalyani sir. With your permission, I start this program. Today's topic is an insight into thyroidinum, insulin, and carcinosin, a study and discussion in relation to everyday clinics. It is very glad to inform you that the speaker is my batchmate, my batch topper, that is Vivekananda Chakravorty. He will give the lecture. I am very honored that I introduced my batchmate Vivekananda Chakravorty for this. He has a vast knowledge and good practitioner. He had a 3-generation practitioner in homeopathy. So let us call Vivekananda. Now, before that, we call the moderator. Today's moderator is Abdul Motin Mollah, the professor and department of the community medicine, Nehru Homeopathic Medical College and Hospital, New Delhi. He is a very good PGT. Also, he's our senior of our NIH. So let's call Abdul Motin Mollah Bhaiya to call moderate this. Okay, let's go to Abdul Motin Bhaiya.
Good evening to all. Respected Dr. Kalyani sir, Dr. Bidyut Mukherjee, Bidyut, and all the respected member of our Alumni Association and all the viewers across the globe. Today's topic, it is very relevant and for the many, it may be the new as this actually among these three medicines, though it is actually used by the many physicians as polycrest, and it is actually not being used for the as many successful physicians as well. So NIH Alumni Association, this platform, it is a very good opportunity for this share of experiences, knowledge, which can enrich and always enriches this other. So for from this different aspect of the knowledge and the practices. So with this hope, this today's topic and that insightful this actually discussion over these three important notions and circuits. So and today's the speaker Dr. Vivekananda Chakravorty. So already given by this inaugurator Dr. his batchmate Dr. Parvez Khan. But in addition to that, actually, what happened? Myself and Dr. Vivekananda. So we are actually from the same locality, and in addition to that, I know him much more better in this way because his father, Dr. S.P. Chakravorty, renowned homeopathic physician, and was this my teacher of in this from the Mahesh Bhattacharya Homeopathic Medical College and Hospital. And I know Dr. Vivekananda Chakraborty that not only from his actually what is happening background, not only from his this actually qualification or the my association from the NIH. In addition to that, actually what happened there are the different type of this homeopathic physician. So most of us we are actually what happened we are the professional, but the few among us who has the passion, who are the passionate homeopath. So I know that Dr. Vivekananda Chakraborty, he is of course homeopathic professional. In addition to that, he is a very passionate physician, passionate homeopath, though their number is very less. So we know that all the viewers they are waiting to hear from Dr. Vivekananda Chakraborty and not from myself. So I don't want to waste much more time, and like other I will also this actually what I want to know also from the Vivekananda Chakraborty from his clinical experience, from his usually the knowledge about these three nosodes and sarco. So Dr. Vivekananda Chakraborty, now the this platform stage is your. I welcome you, Dr. Vivekananda Chakraborty.
Hello, am I audible? Dr.
Yes,
Ortho,
yes,
am I
you are audible. Yes,
Okay,
you are audible.
okay. Uh, Dr. Kalyani sir, good evening. Dr. Bidyut da, good evening. Dr. Prolay da, good evening. Dr. Abdul Motin da, and my beloved batchmate. A very good evening to you, Dr. Parvez. So I am glad to get you on this platform today. Basically, Dr. Parvez, he is my classmate. We studied in NIH for 6 years. We passed out in 2005 after completing the internships and all. After that, we do have contact over telephone and all. And also we met in one or two episodes in NIH. Okay, so I would start with the insulin today because I have asked I have asked Dr. Kalyani sir for a second session of the same CME. This is a part 2. I don't know how far I'd be able to discuss today. Maybe the thyroidinum part I would discuss in the next episode, that is on 11th of May. Let us try with the as much as I can about the three drugs. And as I said, the topic was chosen by me. Dr. Bidyut told me you can choose a topic and tell us accordingly. We would fix it. So what I thought that these three drugs could be a very good topic. Discussion on these three drugs could be a very good topic in present day scenario. I mean, today we are living the days with the cases which are not very easy like the earlier days. So these drugs, specifically, I would say about the carcinosin and thyroidinum, because insulinum It's a very small drug, and I don't have much experience with insulinum so far. But I would start the one case of insulinum. The seminar I would start with the one case, and then I will go to the carcinosin and all. So it was, I don't remember the year exactly. It was somewhere around, it was 2006 or 2007, when I was practicing in my own clinic, that is our ancestral clinic. So one gentleman, he was 70 years old then, a retired primary teacher, who came to me with an eczema. I don't remember exactly whether it was on the hands or legs or feet. I don't remember that, as I have no records at present. So he was a diabetic patient. So what I did when I was inspecting the case. So I never go into it is a common practice of mine. I don't go into very detail of the case, keeping on the mind symptoms at the back of my mind and asking continuously about what is your fear, what is your desire, what is your aversion, what is your anxiety, what is your life situation. I am mostly fond of giving medicines with the pathology or the generals of the case, sometimes also with the particular symptoms of the case. That might be a very strong particular, that might be a particular symptoms in relation to the pathology itself. So in that case, it was an eczema of the patient. I mean, that gentleman, a retired primary teacher, which was not healing. And the most important part of that, you all know that the eczema, this has a component of atopicities and all, atopic varieties and all, mostly. So it was very much itchy. So he kept on itching the parts all the time, and it was with the nails and all. It was little bit of infection was there. It was secondarily infected. It was not a heavy infection, so that I could tell him that please go to an allopathic physician and have some antibiotics, because skin infections are sometimes notorious, as we know from the knowledge of the disease and knowledge of the practice of medicine. So I took the case. I thought that I can take the challenge of treating the case with the homeopathic medicine. So I took that. Immediately, the drug insulinum came in my mind, as the patient was diabetic, and and the eczema was there. It's a very strong indication of insulinum. If you read if we go through the book Elements of Homeopathy by Dr. P. Sankaran, I am just reading out the line so that later on I will explain. So, in some cases of eczema in patients with chronic liver disorders, it is a great reactive remedy in allergic eczema. I repeat once more, in some cases of eczema in patients with chronic liver disorders, there's a full stop. The next sentence is, it is a great reactive remedy in allergic eczema. That hit my mind. I prescribed insulinum 30 BD for 7 days. Along with that, I prescribed calendula mother tincture for external wash and all these things. After 7 days, the patient came, and I was very happy to see that the infection was less. The 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 location, I mean the area of the lesion was less, and I mean the area was little it was little less than it was in the previous time, the first time I saw him, and the radius and the diameter of the lesion I am talking. So again, I in the second follow up, first follow up, sorry, in the first follow up, I put on the insulinum 30, no change of potency, nothing, BD, and the calendula. After 15 days, the patient came, and he was very much better. I mean, if I explain it, what betterment was with the patient, the lesion was smaller, itching was gone, and the patient was better. There is no infection, nothing. So then only after that I found that it is certainly a good reactive drug, or remedy for cases of the allergic eczema. We know the eczema has allergic components and all. So that is one of the strongest indication I found in insulinum. And the another one, which is a routine prescription nowadays, which has been a routine prescription of me nowadays in my clinic, which I can say, in the cases of irritable bowel syndrome, or in the cases of the functional bowel disorder, as the diagnosis is made by the gastroenterologist and the books. It's a routine remedy prescribed by me, insulinum 30, mostly 30, sometimes also 200 to the patient. I mean, for the patient, I prescribe this OD or BD dose along with some other medicines. I cannot say that even in my seminars earlier, the CMEs, I have done 2 seminars beforehand. So there also I spoke about that I am not very vast in and not very keen as well, very confident about giving one medicine all the time. So I prescribe 2-3 medicines. So this is the second one is the insulin in IBS cases of the functional bowel disorder, which we commonly suffer. The patients come to our clinic with these cases where you are not getting any pathology in the intestines. So for the intestines, the colonoscopy and the other tests performed and all. So this is the second one, which is a very good clinical indication for the insulinum. You can also give insulinum in a case of chronic diarrhea where you are not getting any apparent cause. Nowadays, it is very difficult sometimes in our everyday clinics to push the patients for the colonoscopy to rule out the IBS. Sometimes from the symptoms we come to the diagnosis that it's a case of functional bowel disorder, because all we know from the practice of medicine that there are certain symptom complex in a case of IBS, the anxiety, the hypochondriac patients, the symptoms, bowel symptoms, the alternation of the symptoms of the diarrhea and constipation. Patient goes to the bathroom often and patient sits there for a pretty good time. I mean, patient is not defecating well. So patient has a tension the day he comes from the bathroom. Again, he feels that there is some sensation, there is some stool in the bowel, so in the intestine. So this goes on. So these are the certain points which is essentially required. I mean, I take these points for the cases to prescribe insulinum, and mostly in 30 potency I prescribe. Again, I want to read out the another line which can corroborate these symptoms with the IBS. That is from the same book, Elements of Homeopathy. Chronic intestinal disorders, especially with diarrhea and enlarged liver, the more chronic the diarrhea, the more insulin is indicated. It's a very good clinical hint of the insulin. And one thing must be mentioned here with the liver. Dr. P. Shankaran is telling repeatedly that with this is a concomitant. I mean, there is anything with the liver as well as the intestine. There is something with the eczema as well as the liver. There is something with the intestinal problem as well as the liver. I mean, the liver is a concomitant here. In my private practice, I do not take always the concomitant of the liver. If I find that, it is fine, okay. If I don't find that, even I don't bother of prescribing insulinum. So this is the another indication. And if you get clinically evident hepatomegaly in the insulinum cases, I mean, it would be better. You are in a better position to prescribe insulin in those cases. And also nowadays, if you do USG of the patients, say if you perform USG of 100 patients, there's a fair chance of getting enlarged liver or hepatomegaly or non-alcoholic or alcoholic fatty liver, grade 1, 2, 3, like that. Depending on the cases, there's a fair chance of getting that. So again, the insulinum is indicated there. So very few indications about insulin. Then I'd start with the carcinosin once I finish this insulin. There are a few more points. It's a very good drug for boils. It's a very good drug for ulcers, furunculosis. You can give bait sores, I mean the decubitus ulcer. All those things are in clinical practice. There is no mental symptoms here. There are no physical generals here. This is only the indications. You go on seeing the things and then getting into the idea of prescribing insulin. And that's all. And bed sore is there, and sequelae of infections. I mean, the sequelae of skin infections. Patient is having repeated skin infections and all, streptococcal or staphylococcal infections, skin infections on a repeated basis, or any other mixed bacterial infections of the skin, and the sequelae of the infection. Patient is not better after those infections. Patient is having the past history of such infections. Patient is repeatedly falling into such scenario. So you can prescribe insulinum. So, which I spoke about few minutes before, that enlarged liver is an important clinically verified objective concomitant while prescribing this drug. This is a very good point which Dr. P. Shankaran mentioned about insulin. There's another very good point for insulinum in case of children, also in a pediatric setup. You know, in the village setup, many of us encounter the chronic suppurative otitis media, secretory otitis media of the children's cases. So insulinum is again indicated here. You can give this drug for them. We all know that Silesia is a very good drug for perforated tympanum. We all know that Silesia is a very good drug for where there is a suppuration. We know other drugs also. We know graphitis. We know even sulfur. We know lycopodium. Even sometimes it acts very well. We know lachesis also. It is a very good drug to clear up the pus. If you see the rudder 9.2 synthesis, you will get this drug lachesis under the same symptom. And the other drugs are also there. Myristica is there, Hippus-sulf is there, Calcarea sulf is there. But if we go on telling 7-8 drugs, 10 drugs, or the drugs from the Materia Medica or from the repertory, the insulinum is certainly a reactive in these cases of the children, specifically with the suppurative otitis media, especially the chronic one. For the acute suppurative otitis media, I mean I'm not talking about the otitis externa. I'm talking about the media. So for those cases, Dr. Boger and other stalwarts, they recommend ferrum phos in high potency. Hippus-sulf is probably the Hippus-sulf was given by Dr. Douglas Borland in high potency, and ferrum phos was given by Dr. Boger, CM Boger, in high potency. They used to practice. Dr. Borland was a practitioner of Royal London Children's Homeopathic Hospital in London, so he was very keen of prescribing in the children's cases. So apart from that, Hippus-sulfur and ferrum phos for a chronic one, you can think of this insulinum. There is another very good indication of this insulinum. It's a very good, but we don't get it often. I read one article from Dr. Marguerite Blackie's book. You perhaps know she was a doctor of Her Majesty of England once upon a time. So her favorite drug for mastoiditis was capsicum annum. So I'm not going into the capsicum annum, but it is also a good drug. This insulinum is also a very good drug for the mastoiditis, though I have never been into this scenario any time in my life. I have not seen any cases of mastoiditis or acute mastoiditis so far. And there are some good clinical tip of insulinum, some more. Hair fall is a good clinical hint for the insulinum. You know, there are many drugs for the hair fall. You have Wiesbaden, one uncommon drug. You have the other polycrest. The cifilinum is a very good drug for hair fall, and acid fluoric is another very good drug for hair fall. There are many, so I'm not going into that. Even Natramure, Carovage, these are sometimes Thallium metallicum. These are also very good drug for hair fall sometimes. Thallium has a separate indication of hair fall, so you can get it in the Boric Materia Medica also for Thallium. And it's a good clinical hint that hair fall is also a very good symptom of insulinum. The last point about the insulinum, you can get it in the clinical setup. Often we get it, the calf muscle pain, patient has pain in the night, the patient suddenly gets up from bed and he suffers with the calf muscle pain. Patient says that there's a contraction sensation, there's a pulling sensation, there's a drawing sensation in the calf muscle. So you can prescribe insulinum as intercurrent with the other medicines as well. So another very good important indication, another one or two I will say about insulinum, the burning sensation on the palms, I mean palms and soles, these are another good indication of insulinum. You know, from the Materia Medica, there are many drugs, ample of drugs are there, sulfur is there, lycopodium is there, medurinum is there, there are many. So you can think of insulinum in those cases, because sometimes I do love to treat the pediatric cases, and many children come to my clinic for in this setup. I mean the pediatric setup patients and all. So sometimes patients' mother tell me that they keep their feet out of bed in the night. They don't take the cover. So insulinum can be given in such cases as intercurrent. You can give. You can have a look into that also in insulinum. And another very important hint of insulinum, these patients have drowsiness. They are drowsy. Sometimes you see the patients, they are not very, what to say, vigor is less. They are drowsy, they are little lethargy, they are weak. When I will talk about thyroidinum, if possible by today also, because there is a next session also, I will be elaborating that on those drugs also, again with some other ideas and core things. So even drowsiness is a very good indication for insulinum. And there are a few lines from the book itself, The Elements of Homeopathy, I must read out, though I have never encountered such thing in my life. That is, Dr. Mojumdar has published his experiments with insulin in potency in cases of diabetes. He says that insulin 30 or 200 given thrice a day reduce the blood sugar levels. Later, in some cases, even after the doses were reduced and discontinued, the blood sugar levels continued to remain normal for over 6 months. I have never encountered such, and in my practice, I don't prescribe any homeopathic drug for diabetes mellitus per se. I don't say to my patients that please discontinue or please don't go to allopathic physician for diabetes. Let me treat your diabetes and let me give some homeopathic medicines which will cure or which will take your case, which can embrace your case. So I don't do that. I keep on telling the patients, okay, if you have diabetes, if you have such things, I mean, if you have hypothyroidism, if you have thyrotoxicosis or hyperthyroidism, if you have hypertension, please visit allopathic doctor and please come to me if you have any associated symptoms or any associated complaints which may arise with these. From the practice of medicine books, we know what are the other issues which can crop up in a case of diabetes mellitus. Either it is type 2 or type 1. Type 1 is a different one. Type 1, I have not encountered many cases. Type 2 mostly, which I see in my clinics, everyday clinics. So, which I was talking with Dr. Motinda 2 days before that. I have a love for treating these NCD cases, I mean non-communicable diseases, which I have spoken about just now. So they have comorbid conditions with these diseases, I mean with the diabetes, with the hypertension, with the hypothyroidism and all. So the comorbid conditions sometimes can be well managed by homeopathic medicines, and these are the drugs which we can really ponder over. I mean, we can think of these drugs for those cases. So that is all about insulinum from my side. If you can add some more points about insulinum, I'd be glad to hear those. So let us start the next drug, carcinosin. I shall start with a very interesting case about carcinosin. I don't remember. I just want to say you about a Hindi movie. I don't remember the name of the movie. Carcinosin. The history of carcinosin. I mean, the past history of carcinosin is such. I was thinking of that scene for last 2 days. So one movie was there, Javed Jafri, or I don't remember. ऐसे कुछ था, नाम बताते बताते गोवा पहुंच जाएगा. I mean Iyer, then Venugopala Iyer, then some prefix, and like this way Attapattu Iyer, Venugopala Iyer. So carcinosin is such. Carcinosin, if anybody, any doctor starts speaking about carcinosin, the history is so vast of the carcinosins. I mean, the history is so vast about the carcinosin cases. You keep on telling the history, and that will complete one seminar about carcinosin. Carcinosin is very much indicated in today's scenario. In my practice, it is very much indicated. One of my students, she's a lady doctor. She's a BHMS. Nowadays sometimes I get the privilege to teach the juniors in my clinic. Sometimes they do come because I have a clinic in Mecheda. I have a clinic in my place in Uluveria, at Uluveria also. So sometimes they do come, and one of a lady doctors, she was telling me, how often do you prescribe carcinosin? She used to come to my clinic on a regular basis. After that, she got married and she is having a baby now. So it's difficult for her to continue now. So still, she keeps contact with me for the cases and other things. She sometimes discusses with me. So she was asking, one day she was in my Mecheda clinic, she was asking me, how often do you prescribe carcinosin, sir? So I replied her that it is very often. I tell my assistant in my Uluveria clinic, because I have a polyclinic in Mecheda, so there are many assistants. In my Uluveria clinic, there is one assistant. So every time I tell her, my assistant, that please keep carcinosin ready all the time. I must never see that there is the carcinosin is out of stock in my clinic. As well as Thyroidinum also, I tell her that please keep the stock all the time ready. The carcinosin 201M. I don't prescribe nosode in 30 potency. I do prescribe sarcode in 30 potency. Thyroidinum, I often prescribe in 30 potency. Mostly in 200 potency, but sometimes I do prescribe in 30 potency also. But carcinosin, I never prescribe 30 potency, so I don't have any experience. Only the Basilinum 30 I prescribe sometimes for the cases of the Tinea corporis and Tinea cruris. But tuberculinum bovinum, tuberculinum aviary, carcinosin, medorinum, always I prescribe in 200 or 1M potency. I never prescribe in 30 potency. I don't have any experience. So that is what carcinosin is to me in my clinic. So I remember a very good case in my clinic. A young girl with a keloid on sternum. She came to me with her father from a remote village of Mindapur district in 2006 or 7. I don't remember. I passed out after 2-3 years of passing out. So I prescribed her graphitis, silesia, the drugs from the Materia Medica we know and we studied from the first year for the keloids, for the scar tissues and all. She had a boil. The boil was cleared. I mean, the boil was done. After that, she had the keloid. It is a common history. You all know this is a very common presentation of keloid, and you know the keloid. It was itching keloid. I prescribed most of the drugs, but it was off. I mean, it was in vain. I mean, there was no result. So one fine afternoon, her father told me in my clinic, doctor, there is a humble request. I asked her, what is the request? So he told, my daughter is 19 years old. There's a common practice in village. Sometimes if we get a good bridegroom, we give our daughter, I mean, our daughters get married and all. So we got such. He is a teacher of a school. So I want her to get married very soon. So please do something, doctor, because otherwise there will be some difficulty, maybe in my in-laws' house and all. It happens sometimes in the, and it's a practice in the village that people do marry early. The girls get married early and all. So I was disturbed. I mean, I found that the urge of the father was, I mean, he was very, he was urging. I mean, he was very much upset that I have treated the case for more than 4 months or 5 months, and they were patient. I mean, they had the patience of treating the case, getting treated the case by me. So I read Fobister beforehand. Some of the books are with me of Dr. Fobister, the legendary physician who had lots of proving, I mean, huge proving of carcinosin in Royal London Children's Hospital. We can say Dr. Templeton, Dr. Ella Twentyman, and Dr. Fobister as the authorities of the carcinosin drug. So he prescribed carcinosin in one case of keloid in his in practice, Dr. Fobister. So, and that was a very good case. I can read out in the next seminar because I have the book with me. So that hit my mind. I mean, I prescribed carcinosin 206 doses, BD for 3 days. And I told the patient to come after 15 days. I was astonished to see after 15 days, the size was reduced, the thickness was reduced after giving carcinosin. Then I again put her on the indicated remedy. I don't remember at this moment. I'm not talking about the indicated remedy again with taking the mental symptoms and all. With has it with the I took the indicated. I mean, I chose the indicated remedy which has some pathological relation with the keloid itself. Maybe it was graphitis, maybe it was silicea, maybe I don't remember exactly. Along with that, I gave Thyroidinum 30. So in 2-3 months time, the patient was all right. The keloid went away, and the patient was fine. They were very glad. They came to me, and the father of the girl told me, "We are saved, doctor. We are saved. You saved us." So this is carcinosin, the start of the carcinosin to me in that case. So now I would say some of the, I would read out as I prepared the topic of carcinosin for this seminar. Only the clinical part I will do. This is very useful also in PTSD, post-traumatic stress disorder. We all know from the practice of medicine books that what is PTSD is. Many patients have been suffering or suffered with this disorder after the COVID, after. It can be anything. I mean, it's a large, it's a very large group of. There's a large group of symptoms which may arise under this heading PTSD. So this is a, maybe it's an old fright. Maybe it's an old injury. It's an old accident. The patient was traumatized. Maybe the physical trauma had some implication. I mean, had some effect on the mental aspect of the patient. So again, carcinosin is very much indicated. If you doctors, if you get to see, if you come to know any cases of PTSD, please try carcinosin once before going into the details of the case. I am never telling you that don't take the symptoms, don't do the case taking, not like that. Please do all these things, but please think of carcinosin in PTSD cases, post-traumatic stress disorder cases. We have many. We have aconite, we have opium, we have had many drugs for PTSD and all as per our Medica. So it's a very good choice. The next very good clinical hint of the carcinosin, which we all know from the Materia Medica, the complexion, the coffee colored complexion, the cafe au lait complexion. If you read Practice of Medicine, there are some other syndromes associated with cafe au lait complexions. The coffee with male complexion is a French word, originated from the French. I cannot pronounce it like the French people do. So this is a very good clinical hint for the carcinosin prescription. Another very strong, these are, I am telling about the proving, the clinical proving symptoms which Dr. Fobister and Dr. Other, the stalwarts of the carcinosin, what they proposed about carcinosin. Later on, Fobister clinically proved many other symptoms, and he gave many other indications also. Insomnia is a very strong indication of carcinosin. I spoke about drowsiness in case of insulin. Now I am talking about insomnia is a very good clinically found symptom of carcinosin. These patients do suffer from insomnia. This is a very good hint. There are other drugs. We know Insulinum. We know even the sulfur. It's a great sleep producer. I don't know how it is a very good sleep. It is a very good sleep producer, but certainly sulfur is a very good sleep producer. If you're not getting, I got such patients in my clinic. I do have the experience of treating such patients. I'm not getting any symptom. Patient has, it's like patient is telling me that he is having insomnia. I'm not getting anything. Let us give sulfur 200 few doses. See after few. I have a common way of treating patients. Give the drug, try it something, call the patient after 15 days. Let's see what happens. Sometimes it happens if you give a broad spectrum drug. Sometimes it happens that if you give a nosode, after a fortnight or something, after certain days, after certain period, the patient will start telling you the symptoms. A better picture you may get, which we know from the indications of the nosodes. It is not only for the nosodes also, sometimes for the polycrest also. It is my experience, I can share you only. I don't know about the others. And there is another very good indication of the of carcinosin is elementary disorder. I was talking to Abdul Motinda 2-3 days back. If you open Boric, the carcinosin, it's a very small write-up on carcinosin. 8 to 10 lines. Please see how did he mention carcinosin in terms of the elementary system? The flatulence, the dyspepsia. I must say one case. Few days back, I didn't take the follow-up. I just have given the drug. One lady came, 40 years old. She had the only problem of flatulence and dyspepsia. No other. Everything NAD. I got nothing. Clinically, I didn't get any of the other symptoms, any signs, anything. Her lungs was okay, her abdomen, everything was okay. So she told me, I just went on telling, I was with the history and all. Suddenly she spoke that her mother had cancer. So there are, the two satellites. One is she was having dyspepsia and the flatulence, and the other end, her mother had cancer. I immediately told her that, okay, let me give this medicine, come after 15 days, visit me after 15 days. I may go with the USG and other tests to see your liver, to see your gallbladder and all, as you are having flatulence and dyspepsia. I prescribe carcinosin. So from Boric, the dyspepsia and the family history of cancer, the first year students also know about the carcinosin. So these are the hinges. I do prescribe like this way. In all the cases, I have a torpedo prescription because I don't have much time treating the patients in my clinic, telling constantly what is your mental symptoms, what is your physical symptoms, what is your fear, what did you do in your childhood, how was your brought up. I don't have much time. Sorry to say, but I don't have much time to do that. So I have to go with the torpedo prescription sometimes, torpedo method. So these are some of the torpedo methods which I apply in my clinics. So from my experience, I can say that they are the dyspeptics, the carcinosin. They are the irritable bowel syndrome patients. They have the vague dyspepsia. Doctor, I have something in my stomach. Doctor, I have something in my epigastrium. There is a ball-like sensation. There can be ample of symptoms. There can be many. I mean, it's not that they have only ball-like sensation. They may have anything in the magic box. They can tell you. Another one is diarrhea in infancy and in early childhood is a very good indication in terms of the alimentary system for carcinosin also. I have also treated cases of carcinosin of carcinosin patients with the PUS, with the history of PUS, peptic ulcer syndrome, or the gastritis. We commonly found the antral gastritis. We commonly found the Helicobacter pylori infection. I would say I would discuss about the Helicobacter pylori infection and thyroidinum later on, if possible today, if not possible in the other session also. Or also, if you have a strong family history of peptic ulcer syndrome, you can think of carcinosin as an intercurrent to the case. So there are a few. I mean, there are not a there are many. Another very important proving symptoms of carcinosin is fear and anxiety are the strong clinical hints of carcinosin. The apprehension, the apprehensive child, the apprehension, the anticipation before the examination, before any ordeal, before meeting any strangers, before meeting any of their relatives whom he has never seen. So this is again carcinosin. You know, there are many drugs. The Silesia child is very shy. The Baraita cup child is very shy. Even the Lycopodium child is very shy sometimes. We know even the Argentum nitricum, they're not very shy, but they're they do suffer for the anticipatory ailments and all. We know the Gelsemium. We know Ethusa synapium from our Metria Medica, what they do. We know phosphorus also. So I'm not going much into the details of the relationships of the remedies with carcinosin, but you can think of carcinosin in the patients it is mostly, I mean, I most often prescribe carcinosin in the pediatric age group patients. Not only that, also in the adults group also I do prescribe carcinosin. So fear and anxiety are the very hallmark of carcinosin, I can say, hallmark symptoms. In pediatric age group, carcinosin child cannot cope with other children well. There's a very good clinical hint. Say many of my patients, they come with their children, with their only child to my clinic. As I have a flair, I can say I love to see the pediatric cases in my clinic. So doctor, he got admitted in school or she got admitted in school. He is 3.5 years old, but it is very difficult. He's not being able to cope with the others, with his peers, constantly crying, not wanting to go to school, doesn't like to take tiffin, doesn't want to mingle with the other students. Even the teachers cannot control her or his tantrums sometimes in school. Please think of carcinosin in such cases. I'm not talking about the ADHD, autism and other autism spectrum and other. Just simple this type of patients. You can think of carcinosin. We know from the Materia Medica. Let me check out in the radar whether I don't remember at present moment, because it is very difficult sometimes to remember all the drugs from the repertory itself. I don't have a very good memory. I'm sorry for that. Let us check whether in the homesickness rubric carcinosin is there or not. We know many other drugs as homesick, they are very homesick, but let us check whether carcinosin is there. Yes, carcinosin is there, but the addition is there's a one point in carcinosin. I don't use carcinosin in homesick patients, but the apprehensive child, the child who is afraid of going to school because of the apprehension, you can think of carcinosin. They do suffer from anticipatory anxieties, anticipatory events, as I told. Even the carcinosin child is very sensitive to reprimand. If someone reprimands them, they get sick. I mean, they cannot cope with the situation well. So this is again is a very good indication for the carcinosin, and they are also very sympathetic to others. But a very good contradictory point of carcinosin here is they dislike consolation like natrum mure. If you console a pulsatilla child, there's a fair chance he will get consoled. I mean, you achieved your goal in your clinic. If you try to console an natrum mure patient, it is very difficult. If you try to console a Kelly cup patient, it is very difficult sometimes, a Kelly cup child. The Kelly cup child in my 20 years of practice, it is 2025, I passed in 2005. After that, I'm into practice only. I have never been into other things. I'm in other professions and all other. But carcinosin, they are sympathetic to others, but at the same time, they cannot be easily consoled. It's difficult for the carcinosin. They love thunderstorm. They love singing. They love the company sometimes. But sorry, they are not very consoled easily, which I also found is a proving symptom by the Fobister and the other stalwarts also. So they are more with who absorbs the affection, who absorbs the affection from the others. Sometimes they also give. If you see a phosphorus child in your clinic, I have seen many times, phosphorus child comes, doctor, what is this, your pain? They take my pain, they take my the page of the case taking and all. Sometimes they kiss me. It happens. Small children, they come to my clinic, phosphorus. You can get it. But carcinosin, they absorb the affection mostly. They have a very attentive mind. They are very keen also mentally, as the phosphorus patients are, as the lycopodium are. They will absorb what you are telling. They will observe you and they will take the affection. The most important, another very important aspect of carcinosin is they are very fastidious, very fastidious. Probably it is one of the best remedies of Materia Medica, who are very fastidious. They're very particular. Arsenic, we all know. Graphite is sometimes they are very fastidious. Natrum mure is also very fastidious. Nux vomica is also very fastidious. There are some other drugs. Silicea is also sometimes very fastidious. Lycopodium at times in my clinical practice, I find that they are also sometimes very fastidious. Let me check whether it is in synthesis or not. Let me check one. Please give me one moment, because it is very difficult when I start with any topic. Sorry. Let me check whether lycopodium is there or not. Yeah, it is given by Kent, lycopodium in one grade. Lycopodium, they are also very fastidious patient. Okay, they're very perfectionist, you can say. These are the clinical hints you can get. They do their work. It's a very you can say they're very diligent workers. Very diligently they do their work. So it is also, they are very sensitive to music. Tuberculinum patient is also very sensitive to music. Graphite is sometimes, at times, they are also very sensitive to music. Natrum mure also is very sensitive to music. Lycopodium is very sensitive sometimes. Even they cry. If you thank them, they cry. The lycopodium patient. There's a very strong clinical hint for the carcinosin patient is, see here, either it aggravates or it ameliorates. It's a proving symptom. It's a clinical. It is clinically proven by the stalwarts. It's a polar drug, you can say. It's a lot of polarity, strongly polar drugs. Like all the nosodes in my practice, which I find is very polar. The basilinum, I don't know about the polarity very much, but tuberculinum, the abscess, the tuberculous abscess from the drug which has been prepared from. So that is very much, you can say, they have the tuberculinum has the polarity, the carcinosin, the medorinum. This sulfur is a very polar drug. When we talk about the carcinosin desire and aversion, we will get the idea of the polarity of this drug also. So see here, it's a very strong symptom of carcinosin is either it ameliorates or it aggravates. As well as you can see in the radar repertory or the synthesis repertory, just we sometimes consider or we take the account of the mountain. Do you love to go to sea or do you love mountains? Patients sometimes tell us. So for the mountains, I mean, if you see the mountain lovers like I am, I often go to mountains, I often go to hills to get the fresh air. So for the love of mountain, I mean, the mountain desire, the countryside desire mountains. Even if you see again carcinosin, there's a drug. It's a carcinosin. It's given by Roger Morrison, a very good American homeopath. It's a very good American homeopath. Oh, you must know the name of the Roger Morrison. Is a very keen prescriber of modern days. I don't know how old is he now. And then if you see tuberculinum given by Dr. S.R. Pathak, even opium given by Dr. S.R. Pathak for the patients of the mountain lover, the ignitia. So not going into that, there's a separate discussion for the mountain lovers and all. Later on, maybe if I get a chance to talk about the tuberculinum, I would say I would elaborate that later on. They are the patients who enjoys thunderstorms and greatly ameliorated by this. It's a very strong indication of the. They start dancing. If you see the thunderstorm, just think of phosphorus. A phosphorus child will start screaming, hearing the thunders, the sound of the thunders, the lightning and all sorts of electrical changes of the weather. I just take the terms of the electrical changes I read from the books of the stalwarts. I don't remember exactly. He exactly mentioned that the electrical changes of the weather strongly, the phosphorus patient is strong. The phosphorus child is strongly affected by it. If you see the repertory, phosphorus is very much scared of thunderstorm, but carcinosin loves thunderstorm. They enjoy in such situation. They start dancing. Next, it's a very good remedy for the alternating symptoms like the laccaninum, like the lycopodium. It's a very good remedy for the alternating symptoms. We often get the alternating symptoms. In my practice, I do get the alternating symptoms mostly with the cases of the rheumatic phenomenon. I mean with the all sorts of rheumatoid arthritis and all. Sometimes I do get these symptoms of the alternating. Today the fingers of the right hand is sore, doctor. Tomorrow it will be on the left hand. So this phenomenon is again with the laccaninum as well as in the carcinosin. Doctors, please think of carcinosin as intercurrent in such cases. You are giving lycopodium, you are giving laccaninum, or whatever may be the indicated remedy you are thinking of in that case, in that very particular case, please think of carcinosin as an intercurrent. As our stalwarts always say, and we do also notice it in our practice, that certainly the nosodes have the capability of unlocking the case. One very good indication of carcinosin, wounds that slow to heal. Please mind the case which I spoke about at the outset. When I was starting with the carcinosin symptoms of that girl who was going to marry, the keloid, She had a boil. After that, she developed the keloid. So wounds that slow to heal, you can correlate that. Then again, menopause, pains after injuries are the good indications of carcinosin. These are all clinical indications which I do verify and I have verified also. There are some more. I would tell because it's a long discussion maybe. Profound implication, profound in pediatric infections and complaints thereafter, the sequelae of infections. I just read out as I prepared, I just read out. Extensively probed by Dr. Fobister, Dr. Templeton, used and probed by, and Dr. Ella Twentyman. Severity or unusual severity. I must elaborate 1-2 points in the unusual severity. What happens with the unusual severity? I saw patients of bacillary dysentery. I saw the patients of the simple viral fever, enterovirus infection, rhinovirus infection, and coxsackie virus infection, and we all know the which happens in the autumn, and which rhinovirus is most common in the times of the winters and all, from the practice of medicine knowledge of practice of medicine and all. So in this particular group of patients whom I prescribe carcinosin, the sequelae is a long. They are not being benefited by the other drugs. The sequelae is they are never well since after the infection. It's a mild infection. The out of 10 children, 8 children are fine, but the 2 children, they are suffering. They are with the sequelae of the infection. So think of carcinosin here. I should read out. Severity or unusual severity of any infection with their sequelae call for this remedy, which includes severe or not so severe recurrent childhood infection. I mind the word, please also mind the word recurrent childhood infection. We all know up to the age of 8 to 10 years, a child suffers from 6 to 8 viral infections per year. If you open the Nelson's pediatric books, you get this. But if you see the recurrent, a child is having 20 bouts of viral infection, not so severe, but the sequel, one after another, repeated on a repeated episode. It's a fast forward one. You can think of as carcinosin. For example, bacillary dysentery, LRTI, lower respiratory tract infection. You know about the bronchiolitis cases. If you read the pediatric books, you will get the idea about the bronchiolitis. I get many patients of bronchiolitis. They have been treated by in the hospital setup, in the nursing home, with the nebulization, and sometimes oxygen is required, and sometimes other measures are given by the allopathic doctors. I'm not going into that because that is not my topic of discussion. You can get it what bronchiolitis is. But if the patient comes to you with the history of bronchiolitis, after bronchiolitis has certain age group, it is more common within the year, 1 year, but after that also it may happen. You can get it from the idea. The idea is you can get it from the practice of medicine or the pediatric books. So LRTI, URTI, pyogenic infections. Furunculosis, that is again a pyogenic infection sometimes. In bracket, I mentioned sulfur and tuberculinum in pyogenic infection, sometimes pyrogen, sometimes Hippus sulf, sometimes calcarea sulf. They are also very good reactive remedy in such pyogenic infections, or the history or the sequelae. Otitis media, which I spoke about, the insulinum. See the satellite. They are the very strategically, I choose the drugs, the thyroidinum, the insulinum, and the carcinosin as my topic. Skin infections, I spoke about the insulinum. Now it is carcinosin, including impetigo. We all know, if we read Tyler, my favorite is antimonium tartaricum for impetigo. If I see 100 cases of impetigo of children, I prescribe 90 at 90 times. In 90 times, I prescribe antim-tart. It does act, but in some cases, there is a chance of bacterial infection. Please see the case and please evaluate. Please, my brothers, and my sisters, doctors, my fellow batchmates, everyone I am telling, please don't bother to tell them to go to a pediatrician or to an allopath for further management if you feel any sort of difficulty or any sort of changes in your in that very particular case, that because in such cases they require antibiotics sometimes, and sometimes also IV antibiotics. Sometimes it may be required because there are chances of infections, because some, as I told, skin infections are notorious sometimes. But you can think of, with the history of the impetigo, you can think of carcinosin. We all know the streptococcal impetigo, the staphylococcal impetigo. These are the other, I mean, the pathologies and all. Recurrent viral colds, bronchiolitis, which I spoke about, nephritis. Dr. Fobister has given the indication of nephritis in relation to carcinosin. Skin and soft tissue infections, recurrent nasal catarrh. We all know from a few days before I was reading Harrison's Principles of Internal Medicine, there is a carriage of the rhinovirus in their nasal secretion. After the infection has gone, the rhinovirus infection, there's a lot of many subspecies of rhinovirus. There are very many subtypes. So people do suffer from rhinovirus infection often, and sometimes the patients who are having asthma, they have the exacerbation of their asthma after the rhinovirus infection, and they have a carriage. In my clinic, the mother comes with their children, the mother comes with their child, telling me that there's a yellow nasal catarrh which is constantly coming up, doctor, after the infection of the cold, viral cold. Maybe it is rhinovirus. It's most likely it's a rhinovirus. And if you check the secretion and all with the all laboratory methods and all, you might get the rhinovirus. Think of carcinosin in such cases in clinics, everyday clinics. We have pulsatilla, we have Kelibicromicum, we have Silicea, we have tuberculinum, we have bacillinum, we have other drugs, but certainly sometimes we must think of carcinosin in such cases. And that is recurrent, which I spoke. Sinusitis, Dr. Fobister is giving indication. Sinusitis, we all know the other drugs. We have the Kelibicromicum, we have the Kelly iod, we have the cinnabaris. I do often prescribe cinnabaris in cases of sinusitis. In cases of inflammatory episodes, SLE, inflammatory disease, recurrent childhood asthmatic bronchitis, ARI, acute respiratory infections. You know, there are two components in asthma. What happens, the chances of getting the exacerbated cases of the asthma, what happens? At one side, there is an infection. Maybe it is viral, maybe it is bacterial. The patient is asthmatic. After that, the reaction, I mean, the inflammatory episodes or the immunologic phenomenon which continues in the patient, there is a immune modulation. I mean, there's a immune stimulation in the case following the infection in the asthma patient, which goes on. If you read Harrison's Practice of Medicine, you will get this internal medicine, this corroboration. That immune response is more with the asthma patient. So after a viral infection or a bacterial infection, it is accentuated. The symptoms and the signs are getting accentuated. Even after the influenza virus, we all know we give vaccine, the H1N1, the vaccine we give, yearly vaccination. I often tell to my patients, please go and take the influenza vaccine, as I am not entitled to give that. So I tell them to go to the allopathic doctor, the aged patient, because either this, if you have a influenza or influenza-like illness, you might suffer the exacerbation of asthma. But think of carcinosin in such cases in your day-to-day practice, brothers and sisters. And food allergies also. You know, when I will talk about, I shall elaborate the food allergies, the latex allergies, the other allergies in terms of the thyroidinum later on. Maybe not possible today because the time is short. That is why I requested them for a next session. Food allergy is also a very good indication for carcinosin. You multiple, the children come to your, is a very frequent thing, peanut allergy, prawn allergy, shellfish allergy, gluten, wheat, many, there are many. Environmental allergens, we know, environment, there are many environmental allergens and all. So, okay, the food allergies. There is another very good point which I would elaborate in my later. I mean, the other day, the cyclical vomiting syndrome of the children, the carcinosin is very much indicated. I am fortunate to treat such patients in my clinic. The cyclical vomiting syndrome. It's very difficult at the outset to diagnose the cases, but slowly it becomes very easy to diagnose once the patient comes and you have a regular follow-up visit. Or sometimes the patient come after a pediatric follow-up, or a pediatric doctor has seen the patient and he has diagnosed the case with the cyclical vomiting syndrome, and you can easily correlate with the symptoms and the diagnosis by the pediatrician, and you are also in the same line of treating the patient as cyclical vomiting syndrome. Carcinosin is very much indicated, brothers and sisters. Feeding disorders in toddlers, it is a very common good indication of carcinosin. Doctor, my child, I am fed up. Totally, I am exhausted feeding my child every day. I just keep on moving with my child, feeding him a morsel. Again, it is carcinosin. It's a very good indication of carcinosin, clinical hint. Doctors, gestational diabetes mellitus is a very good indication of carcinosin. It's not that if you have high sugar level during the period of gestation, you might think of carcinosin in such cases, brothers and sisters. We all know from the Materia Medica, we all know from the provings of the carcinosin, the carcinosin has the family history of diabetes, the carcinosin has the family history of insanity, the carcinosin not the last but not the least, the family history of cancers. As well as the carcinosin has the family history of tuberculosis in the background sometimes, like tuberculinum, like bacillinum, like thuja. Even in the patients of thuja, you might get the history of tuberculosis. I am pausing for Dr. Orko. Dr. Orko.
Yes, sir.
Am I audible properly? Everything is okay?
You are audible. Just continue.
Okay, please. Thank you very much. So again, with the tonsils and adenoids cases, we all know what are the investigations to be done in the case of adenoids. Sometimes I do refer the cases to the ENT doctors, sometimes to the pediatrician to rule out the adenoids, sometimes of adenoids, and sometimes I do also find that there are the cases of adenoids. And the history also in the past of such complaints, such indications are there with carcinosin. The tonsils. In few days before, I was treating a case who came from from Nondigram, a child of 14 years of old. I could barely see his throat. Honestly speaking, I could barely see his throat. The tonsils are so big. The uvula was little elongated. So I started the case with laccaninum. It was not a glistening tonsil, which we know from the Materia Medica, but it was laccaninum to me because the patient had bedwetting. The patient had strong desire for salt and spice. So I came into the totality of the case and I prescribed laccaninum. I told the patient to come after 1 month, and I am going to prescribe tuberculinum bovinum or barytacap or carcinosin or thuja. I don't know, but I'm certainly going to give these drugs in the course of the treatment. So tonsils are usually bigger in size in children. As we all know, it is a lymphoid tissue which helps as a safeguard against infection. It's a guard. But recurrent tonsillitis in childhood calls for this remedy often. From the knowledge of practice of medicine, from the knowledge of pediatrics, we know GABHS, group A beta hemolytic streptococcal infection. These patients suffer with fever, tonsils, pain. There are strawberry appearance of the tonsils. Onset is very sudden, and there is no cough. I am repeating it again. For the cases of, if you read Nelson's pediatric book, without cough, with the symptoms of fever and tonsillitis, there is a fair chance of it is a case of GABHS, group A streptococcal, beta hemolytic streptococcal infection, which we call GAS pharyngitis, group A streptococcus pharyngitis. So in these cases, I never prescribe any homeopathic drug. As I am talking about the tonsils, I am just mentioning it. In one of my articles, I don't remember exactly, in one of the magazines, which some people from abroad, she published. I had a connection with her. So she told me to write some article. I wrote and I mentioned these also to the in the article. So in such cases, I don't prescribe any homeopathic medicines. I simply refer them to pediatrician, because to me, these patients require antibiotics. Okay, Makedak. These patients require antibiotics to me. To me, these patients require antibiotics. So, but this recurrent tonsillitis in the history, this childhood calls for remedy often. The other drugs are lactaninum, silicea, sorinum, tuberculinum, phytolacca, etc. If you read sorinum from Allen, from Boric, strong phagocytic action. We know who are the phagocytes in our blood, the neutrophils. They are the first line of the first line safeguards against the infection. They come and they devour the bacteria. So sorinum is for as a reactive remedy for a good phagocytic action in children. Maybe if I get the opportunity to talk about sorinum later on, I would speak about those. Phytolacca is again a very good drug for acute tonsillitis, but for me, the phytolacca symptoms is very similar to the group A beta hemolytic streptococcus infection, pharyngitis or tonsillitis infection. They do have body pains. If you see the patient of a child of having GAS, I mean the group A beta hemolytic streptococci infection of the throat, in many of these cases you will get the body ache along with those symptoms. And we all know from the Metria Medica, phytolacca is at one side, it is a enlarged tonsils, it is an inflammatory, it's the inflammation of the tonsil, acute inflammation of the tonsil with the pains and aches in the body. But I don't prescribe phytolacca. I am sorry to say, I do refer this case to the pediatrician. Again, I am telling. There's another very good indication of carcinosin is failure to thrive due to recurrent watery diarrhea or the bacillary dysentery and vomiting, including the rotavirus infection and the other viral infections having the gastrointestinal elements and all in the childhood, in the age, in that very particular age. The another very important indication of carcinosin is scar tissue, which I spoke about at the start of my case of that girl, the scar tissue, the keloid, again the scar tissue, exuberance of growth, the keloid, for which I clearly mentioned it. Had treated a young girl of 18 years, which I spoke about, and then there are some other indication also for of the carcinosin. You know, there's a virus which we know EBV virus, Epstein-Barr virus. This is not very common in our country. The glandular fever, which is caused by the Epstein-Barr virus. In the abroad, in the UK, in the Royal London Homeopathic Hospital, the doctors, they are all from the allopathic side, and then they started practicing homeopathy. They are all the allopathic doctors, Dr. Forbister and the other stalwarts. So I believe that they had strong foundation for the allopathy, and that is one of the main reasons they prescribed and they treated the patients with homeopathy very well. That is the which I believe. So in the cases of the history of the glandular fever, if you are lucky, you have got the cases. I don't just give me one moment. Maybe I am not very sure. Just let me one test which is done to know. Maybe this Paul Bunnell test is performed for diagnosing the case of glandular fever. Paul Bunnell, this atypical lymphocyte is found in the diagnostic panel. Paul Bunnell test. Let me check once, because yes, the Paul Bunnell test. Maybe screen for, yes, it is for the infectious mononucleosis, and that is the test which is performed. Monospot test. 1 minute, please. Just give me a time. Just give me some time. Yeah, this is by the Epstein-Barr virus, Paul Bunnell test and infectious mononucleosis to diagnose that. So this is again carcinosin, the indication of the glandular fever, which I got from the books of the Forbister, and there are some more. If in a child, it's a very indication, very good, very interesting one. It's a polar drug. I have told you, either the child has the history of repeated infection or the no infection. Sometimes we do get the patients, what is your past history? What was there in your past history? Doctor, I have not suffered much in my past life, in my earlier days. Now I have been suffering. I mean, it is suffering for with such problems for certain days. So either the paucity of the symptoms, either the paucity of the infections, or the abundance of the infections. Doctors, please think about carcinosin. In cases where it is very difficult to elicit the symptoms of the drug, again carcinosin. You're not getting the idea of the past infections properly. Patient is not in a position to tell you, not remembering much about the history and all. So this is again carcinosin. Use of many medicines for different infections and other ailments call for this remedy often. It is, you can say, it is a drainage remedy. I shall talk about the drainage remedy in the next session. What is the drainage remedy proposed by Dr. Leon Vanier in his practice and in his books? One very good French homeopath. He had we got the opportunity of reading his books and articles from our armamentarium. He had enough of practice with the no-sodes, especially with the tuberculinum and other drugs, no-sodes. So use of many medicines for different infections. Patient has the history of taking many medicines, be it is homeopathic medicines, be it is allopathic medicines or Ayurvedic or whatever it is. Doctor, you might think of carcinosins in such cases, apart from nux vomica, apart from opium, apart from teucrium meramverum. Family history of asthma, diabetes, insanity, carcinosin, sarcoma are also well-known indication of starting the treatment with carcinosin or prescribe it as an intercurrent. Very good indication, as I spoke about, never well since the infections happened in childhood, occurred in childhood. Never well. It's a very common indication of nosode for all the nosodes. Another very important point of carcinosin is a weak digestive system. Again, I want to mention that the insulinum, I sometimes call it bradypsia. There is no term as bradypsia. Dyspepsia, I call it bradycardia. So, cardiac heart rate is, the heart rate is low. Tachycardia, heart rate is more. So bradypsia, the patient is not having good digestion. Patient is having a weak digestion. Carcinosin, brothers and sisters. If you happen to get such cases, and even in our in our the setup in the West Bengal, many patients do suffer the bradypsia, the dyspepsia, and weak digestive system and all, because nowadays it is the peer pressure, nowadays it is the late nights, nowadays it is the stress in the family, nowadays it is the competitive minds, the even the tender minds are very, I mean the children, they are very competitive in the schools, in their coaching. I am a father of a child and I do treat patients, cases of the children, so I do find these patients. So again, carcinosin, they have the they are studying late night. You can correlate carcinosin. They're not feeling like they are having, they need to sleep. The pressure they are getting from their books, from their subjects, they are not in a position to fill for a sleep, for a good sleep. In our days, I was brought up in a hostel. So at 10 o'clock in the night, the warden, hostel warden, used to come and switch. I put off. I mean, the light, the main switch was put off. I mean, it was completely gone, the load shedding, and the early morning we had to get up for the next day. So weakness of the digestive system and the recurrent dyspeptics often calls for these medicines. And I do treat the cases of the ADHD. I do treat the cases of the autism spectrum. Sometimes they do require carcinosin, sometimes in the course of their treatment, along with the other drugs. Glandular fever, infectious mononucleosis, already I spoke about. And the remedy indicated is not working well. This is a very good indication of carcinosin as well as the other nosode, or taking time to manifest its desired actions or the course of actions. Carcinosin is a sheet anchor to these cases to expedite the case or to expedite the cure. The remedy is often indicated in the children with the past. This is a very good clinical hint, which is more in relation with the mental symptoms and the mental aspects of the patient, of the child. But sometimes I do encounter such patient, such scenario, strong family history of the children having strong parental dominance, control over them. My child, don't do this, don't touch this, that is dirty, don't go beyond this point, don't eat that, don't laugh, don't do that, don't do this. So that is a very, every time you are being controlled by your parents every time. So again, carcinosin is a very good drug in such cases. I just tell you, I just let me give some time. I just tell you the rubric, exact rubric, and the other drugs. It would be better for you to correlate the other drugs if you get to see such cases in your clinic. Just elements from, please search the elements from in your repertory. This is synthesis I use. I don't use other repertory. I use only synthesis radar. That is in my software. Elements from parental control strong, 1 minute. Dominance, 1 minute. Domination, children in. You see carcinosin, you see staphysagrina, you see folliculinum. Children in subrubric, under subrubric, you have lycopodium, you have anacardium, you have staphysagrina, you have thuja. By thuja has been given by Dr. Robin Murphy, a very good compiler and a very good doctor. He wrote a very good repertory, that is the Dr. Murphy's repertory. And the lycopodium and the carcinosin had been added by Robin Murphy and the other doctors also. It's a very good strong parental dominance in the children, where the child fails to take any decision of his own because of extreme parental control. It's a mental symptom. It's a kind of a mental symptoms which I don't take often, but sometimes it's a good clinical hint. Never well seems the inflammation of the lungs and the bronchus and the bronchioles. The pneumonia, the bronchitis, the bronchiolitis, the ARI, again the carcinosin. The history of repeated vaccinations like thuja, like silicea, like arsenic, carcinosin is another drug. Even not only that, if you have a reaction, if you have a severe reaction of serum sickness after the immunization or the vaccination, think about carcinosin, brothers and sisters. This is also a very good clinical indication of carcinosin. So, this is all about the history which we take about the carcinosin, and I would like to elaborate a little more about carcinosin, about the hygiene hypothesis. See, there is a hypothesis which is called hygiene hypothesis. It is I am telling from the Harrison's textbook of medicine, and as well as other internal medicine books also has the same write-ups and all. So in the hygiene hypothesis, what happens? Asthma is not prevalent among the children of slums because the helper cells, T lymphocytes helper cells, are not in a position to react in the patients of the affluent society, in the children of the affluent society, often, so that they can have some immunologic memory. But the children of the slums, they do not suffer. They do suffer infections on and off, but there's a less chance of getting asthma in such group of patients. If you see, the patients of asthma are more with the affluent society. It is not my view, it is the view of the allopathic doctors, the great doctors who wrote this hygiene hypothesis and all. So for that also you need to develop asthma, because the allergic part you must consider the atopy. The individual is atopic. If you taste his IgE, I'm not talking about the pediatric age group patients, because the pediatric age group patients have the high IgE sometimes, but it is not always with the adult patients, because you might land up in a different scenario if you go on checking the IgE all the time in pediatric age group. Sometimes it is high in the pediatric age group, so it's not a good hint for the clinical in the clinical setup for the children. But if you have a very high IgE, certainly it has some value with the allergy and all. So atopic individuals are very well managed by the carcinosin. While studying, while I'll be discussing the thyroidinum, I would elaborate about this one. The itch dust mites, the cat dander, the farts, the pollens, the cockroaches, the food allergies and all, the atopicities and all the atopic individuals. These patients have other good you can prescribe carcinosin in such patients. What is atopy? It's a genetic predisposition to develop allergic reactions or heightened allergic response. That is very important. Heightened allergic response to apparently harmless environmental substances. These patients produce specific IgE. We know RAST and the immunologic test protocols and all immunosorbent assays and all ELISAs and all we know. I'm not going into that. Sometimes these reports are not very corroborating with the clinical scenario also, because a patient might be having allergies to multiple things against they are exposed to. I mean, the specific IgEs are high against the things they are exposed to. Carcinosin needs to be given as intercurrent or in the course of the treatment in such cases, brothers and sisters. Let me say, let me little elaborate this. Everyday stress is common in most of the families due to work pressure, inadequate sleep. Sleep is a good medicine, we know. Extra hours of work, peer pressure, and of course stress in the family, making and putting our children vulnerable to disorders. Use of carcinosin would suffice such situations. Hygiene hypothesis I already spoke about, which the examples I have taken from the book Harrison's Internal Medicine's 19th edition, page 167071. It plays an important role in asthma. We parents go extra mile to prevent infections in our children. Clean your hands, use sanitizers, etc. But you get lesser number of asthma cases in the slum areas as they are repeatedly exposed to infections and infestations, the worm infestations, the parasites, the hookworms, the parasites, the ascariasis, the whipworm, the other worms. They are not the sufferer of asthma, which is a common problem in modern day scenario, brothers and sisters. The polarity of carcinosin is very marked. Later in the later part, next part, I will discuss about the polarity in terms of the desires and aversions. The carcinosin has strong desire and as well as the strong aversion for salt, for sweets, for ham, for fats, for sweets, as well as the aversion, like the polarity as in natramure. Natramure, sometimes we all know natramure has a strong desire for salt, but doctors, believe me, if you see repertory, natramure has the strong aversion for salt also. Clinically, I have verified this also in patients. I prescribe natramure, I do prescribe natramure, taking these symptoms, corroborating with other symptoms, it acts beautifully. I would talk about natramure in terms of urticaria when I would discuss about thyroidinum. It's a great drug for urticaria, the thyroidinum and natramure. I would talk about that. So for me, this is all about carcinosin. Another, last but not the least, the whooping cough was a strong indication for carcinosin, but we don't see whooping cough in our days because we have the pertussis component in our DPT vaccines. And it's a very good vaccine as well. So we don't get these cases, but in their days, it was very much indicated in cases of in the history of the whooping cough. And for the carcinosin in the Fobister's book, they have he has mentioned many sources. I mean, the sources are many from the adenocarcinoma of stomach, from the other carcinoma. But I don't know, maybe the carcinosin which I use or you use or we do use, the carcinosin we get from the market, from the medicinal shop and all, it is from the breast carcinoma, which probably Dr. Twentyman and Dr. Fobister. I don't know exactly whether Dr. Twentyman proved it or Dr. Fobister, but certainly they have Templeton, maybe Dr. Templeton, but Dr. Fobister certainly they have prepared this medicine from the breast cancer tissue, and that the carcinosin is as per the Fobister, this is the most useful among the carcinosin. There is another drug which I must mention, as I talked about the intestinal disorder, as I talked about the IBS cases, recurrent diarrhea, functional bowel disorder. Doctors, please, you may think of Bacillinum coli sometimes in cases of chronic diarrhea, in cases of IBS. It's a very good medicine, Bacillinum coli. So from my side, probably I spoke about some of the indications. Another, I should mention also, I was forgetting, there's a very good clinical indication as well as a proving symptom of carcinosin. The carcinosin child sleeps in knee-elbow position. They feel better by sleeping or taking rest in knee-elbow position. That is a proving symptom of carcinosin. That is, it is also a very good indication of Moderator, another very good nosode, which is very useful in present scenario. And these drug can be very well correlated with the other drugs. I should read out some from the Elements of Homeopathy book by Dr. P. Sankaran. If I missed any other indication, so I must refer the book also. In one paragraph, Dr. P. Sankaran is writing, I give it almost routinely. Point number 1, to all patients who give a history of any blood relative having suffered from carcinoma. Point number 2, to all patients who give a history of having suffered from several, at least 4 or 5 acute infectious diseases in their childhood, I spoke about already. And the point number 3, to patients who have several nevus nevi on the body. This is very good. I missed this point. If you tell the patients of carcinosin to open their chest, open the shirt, you see the moles, the red moles, the black moles, the nevus, and the complexion which I spoke about. This is a classical complexion, Caffeolot complexion. So that is carcinosin again. Children requiring the remedy often show a brownish Caffeolot complexion spots, numerous moles. And another very good clinical indication, that is the blue sclerotics. Their network issues. Hello.
Yes, you are audible, sir. You are audible.
I hope I have elaborated little bit about carcinosin and insulinum, because time is not permitting to talk about thyroidinum. I would certainly talk about thyroidinum in my second part. So, please, Dr. Motinda, please.
So, thank you, Dr. Vivekananda. Thanks a lot for giving us this actually informative, elaborative, and this sharing your valuable experience. Your actually experience, sharing of your experience is not only this actually result of your the knowledge you have acquired from this your study. As being a third generation homeopath, this thing usually what happen, it is this unknowingly this actually experiences of your grandfather, your father, this all these things that make your journey easy, that and to make it into this in your practice. So it was our this a very good opportunity to this learn from you. And this thing, this it is actually hardly there is any scope for me to add anything as a moderator. So in this two medicine we have discussed, this insulinum and that of the carcinosin, you have the, as much as I know, you have the actually maximum point you have covered. And in between these two medicine, this thing I have made one excerpt from this synthesis adonis, the latest version of the digital version of the synthesis repertory. So if possible, Dr. Orko, if you can share the slide, so then I can share with this viewer. So this will, I think, probably help that what the Dr. Vivekananda, his experiences, and this thing, it is not the, it is supported, the finding can be supported from this synthesis repertory. And Dr. Vivekananda, he itself used the synthesis repertory. So I will request Dr. Arko, if possible, is it possible? So then you can slide this, actually share the slides I shared with you. So it is the time, it is near about 9:50 p.m. So our time is very less remaining. So if not possible, so then I have print out with me. I can just share with the viewer that from this latest version of this repertory synthesis, the insulin covered only 32 rubrics.
Just give me few minutes, sir. It will be possible.
Okay. Yes, yes. So before that, I can share my experiences with carcinosis, two cases. If this, I want to take permission from our secretary and the president of our organization, Bidyut and Dr. Sir. Sir, is it possible time can permit for me to share two cases?
Sure, Dr. Abdul, please carry on. Sure, Dr. Abdul, please carry on.
Okay. This one cases that was a very chronic cases of the urticaria, and I was treating long time, perhaps more than 6 months, and it was very frustrating for me also. But it was not responding well. Only this temporary relief was there. So then I was taking the case again, and I was discussing in a informal way. That I asked that what is your like the in your leisure time, what you do? That was a lady of around 45 years age, housewife, and she told that actually I read. This reading into this side is usually, it is to some extent less than that of the West Bengal. That is my observation. I may be wrong. That I ask, everybody can read. So how much you read? When you read? The lady told that whenever I get time, I read. She is not a very like the learned even. So I asked that what you read. The lady told that whatever I get, even it is usually the envelope of anything I have purchased. So if what is written into the envelope, I also read this thing. So I find it very interesting that this actually such kind of this interest for the reading. So it is not very common. So then I opened pocket version of the synthesis repertory and search for the rubric that is the passion for reading. And there is a single remedy was carcinosin. And I prescribed this carcinosin. After that the case was cured. And another case is recently, that's 2 months back. That was a one case of the female of 25 years girl, unmarried, CA by profession. She is suffering from this nocturnal neurosis. And this thing, what happened? This is after many kind of this allopathic, homeopathic, ayurvedic, Unani, thus it is not responding. So on inquiry, what she revealed to me that actually what happened, there is history of repeated.
Sir, sorry to interrupt.
Yes.
Is this presentation required or not, sir?
No, thyroidinum is not required. You please this next slide, insulin. Yes, yes.
Just
Okay, okay,
tell,
fine.
sir. You can
Okay,
just
yes.
change it from your laptop also. You can just change it, sir.
Okay, okay, okay. Thank you. So there is history of the repeated abuse, sexual abuse from her early childhood. So this thing is usually this inquired into the again reparatory. This thing it appeared this actually for this abuse. So there is the single memory rubric is carcinosin, and when I going through this different mathematical book, it is written that there is individual into the past history. This person suffer from this actually the condition of like the very fearful condition for the long period of the time. So this thing usually again the another indication of the carcinosin. And after giving this carcinosin, there is no such episode into the last 2 months. This any kind of this nocturnal neurosis, any episode was there. So that was my two cases. Now regarding the insulin, I have not prescribed insulin till date. So I don't have any this my personal experience with this. But recently, 2 weeks back, one of my in this PGT, she prescribed in a case of the type 1 diabetes mellitus for a children of for 4 years, and this thing usually after giving insulinum 30 twice a day for 1 week, the requirement for insulin injection that actually what happened that have been reduced. That is the very recent my passive is usually experiences I have observed. Now in this synthesis repertory Adonis, so in this repertory total 32 rubrics it is actually covered by insulin, and out of which the insulin there is the single memory rubric is usually 3 rubrics are there. This rubric the under abdomen chapter 2 rubrics the enlarged liver accompanied by chronic diarrhea. Insulin is the single medicine. Again under abdomen chapter, enlarged liver accompanied by skin eczema chronic. This insulin is the single medicine. This is actually the first cases shared by Dr. Vivekananda Chakravorty. So usually what happen if this is actually what is happening, it is supported by the finding of synthesis repertory. And again under the genetics chapter, diabetes mellitus accompanied, no, that is from this already mentioned now. Again, this there is no first grade medicine, second grade medicine, insulinum in the synthesis repertory. So the only this actually what happened, the third grade medicine is usually it is given under the urine acetonuria. This insulinum is given into this third grade. So this thing is usually, though there are in addition to that there are the total 17 medicines are there. And under mind chapter there is insulinum is not represented. This insulin covers 6 rubric under abdomen and 7 rubric in under skin chapter. So I am not going in details. So the slide can be shared with this viewer. And for the carcinosin, the insulinum it was proved later on in 1977. So the hour and the maximum this actually symptom they have added from this clinical experiences. Now for the carcinosis, total number of the rubric covered by carcinosin in Adonis version of the synthesis is 2748, and second 7 rubric is usually that is given the single memory rubric in third and the second grade. So this is usually these are the mind elements from fright, children in excitable highly carcinosin, mind consolation kind words from this actually what happened aggravates carcinosin, mind humiliated feeling sexual abuse after carcinosin is the single memory rubric, and skin moles dark carcinosin. Under generalities, family history of numerous serious diseases of carcinosin, general inflammation glands of chronic carcinosin, and general weakness mononucleosis from carcinosin. What Dr. Vivekananda Chakravorty he has nicely usually this elaborated. So this is usually what happened, and this of which this actually what happened. First grade usually 22 rubrics. Carcinosin is represented in first grade, and into the second grade 191 rubrics are there. So the details it is not required So even it is actually anybody want to know, so the slide can be shared. So with this we are coming, just time is nearby 10 p.m. So I will not take much more time. I will again thank Dr. Vivekananda Chakravorty and for his very nice presentation, very informative and sharing his valuable experience. But at the end, I must usually for the newcomer, new junior doctor, my one suggestion is there that you know that how much Dr. Vivekananda Chakraborty's knowledge into the modern medicine. He has gone through the Nelson pediatrics. He has gone through this actually the latest version of this actually your medicine books and the different journals and the how many varied kind of this actually writing of the homeopathic different authors, and he has learned from this his grandfather or father. So how actually only hearing this thing, I was once as usually junior doctor. The our usual what happened, we want to this think that what happened into the younger age, that probably with this carcinosin or the insulinum, this we will cure the all the similar cases mentioned by Dr. Vivekananda Chakraborty or the clinical condition. Don't try to this actually practice in such a way. Of course, we will widen our this actually number of this medicine. We will think of it when the other medicine is usually not acting. We will think is usually how he is actually giving the other different similar medicine from medical knowledge from laboratory. Otherwise, what will happen? The number of the failure will increase. So with this, I want to thank the organizer, Dr. President of our organization, Kalyani sir, and this actually General Secretary, Dr. Bidyut Mukherjee sir, for continuously this actually conducting such actually seminars, CME, to enhance our knowledge, to actually, and this not only this knowledge, this is usually the learning from the different aspect of this homeopathy, that is really essential to keep us all the viewer update. So with this word and thank you this student inaugurator Dr. Parvez Khan. So I am this actually must actually now it is time for our president and Bidyut. Thank you all. Thanks viewer.
Thank you very much. Thank you very much,
Thank you, Dr. Abdul. And over to you, Kalyani sir.
Dr. Bidyut.
Thank you very much.
Dr.
Bidyut
Bidyut,
Mukherjee, our able,
hello,
competent
Dr.
judge.
Bidyut.
And
Probably,
thank you, Professor Abdul Motin Mollah, for fantastically
hello.
moderating the session. Along with, he has contributed from his own. And Parvez Ahmed is very close to us, fantastically. He has inaugurated the program. Thanks to all of you on screen and out of screen. It is already late today. We have already covered 2 hours. And our brain is now taxed with carcinosin and insulin, what is my realization. We don't have any single session of CME where we don't learn anything. So Dr. Vivekananda Chakravorty, by his excellent presentation and fantastic knowledge on modern medicine and homeopathy, has provided multiple information which are not known to us, to many of us, regarding many sides of carcinoma. Today time is short. If I get time in the next phase, I will try to share my experiences. But one thing I can tell you in brief, that there is one evolution of this no-source and sarcodes in therapeutic practice in the world. That I will tell you next day. But one thing is very sure, the more you are complicated, we are becoming complicated physically, mentally, socially, iatrogenically. We are bound to invite no-source and sarcodes. As Dr. Chakravorty was telling, that I never agree that my stock has been finished. Always we must be full and ready with stock of the no-source and sarcodes, because the situation has brought us here. During our student life, we rarely found teachers are prescribing no-source and sarcodes. They were more dependent, more confident regarding the traditional proofing drugs. They are successful. The more advancement of the day, but we find that the commonly traditional proofing drugs are not competent to cure many diseases. That's why whole profession has been compelled to move upwards towards the no-source and sarcodes. Just one thing I want to add you, that as I told you that centesimal scale, use of centesimal scale, millisimal potency, 50 millisimal, was vastly used and utilized by the NIGMs, means NI students. Before that, rarely we heard about the millisimal potencies. When we found in IT during our classes, different teachers coming from all over India and sharing their experiences, then we realized, even in Calcutta, that notions used to be practiced politically all over India and abroad. Ultimately, we gathered all the knowledge from all brilliant teachers of the country. During our time, all famous teachers and practitioners used to be invited in NI. They were given good hotels to stay for 3-4 days. And they will take continuous classes since morning 9 to 5. Nobody knows when class will be ended. Only one teacher, one class, one whole day. All the classes will be suspended. They are our guest lecturers or guest professor. From them, we are enriched in no-shoot drug. Then we started practicing. Equally, as I'm telling that 10 decimal scale was more propagated by NIGians, NI students. Equally, the abundant use of no-shots were also been more propagated from NIGians when it started from National Institute of Homoeopathy by getting knowledge from all corners. And we have seen nowadays that successfully we are proceeding with no-shots. Anyway, it's too late today. Many thanks to all of you. There are many things to learn from different no-shots. Vivekananda Chakravorty should deserve a standing ovation for his effort to present this type of seminars. Thank you, Vivekananda. Please carry on and share us knowledge to enrich our knowledge. Thank you very much, all of you. Please come again, and all of you are requested to come out with your experiences to enrich us. Because you don't get time. After getting passed from the institution, first we become busy for our establishment, then we become busy with our marriage, then we become busy to have children, then we become busy for marketing, some shelter, management of the children, wife, etc., and along with chambers and practice. So really get much time to study. This is the platform where with a very short period, we can gain many, many information. Is it possible for any one of us to gather all the knowledge as we were going to presented today within 2 hours? Impossible. So that is the highest benefit of this CME. All of you, please come forward with your experiences and enjoy, learn more and more and more in little time. Enrich your knowledge and be prompt and steady and sharp and proud of being Homoeopathic. Thank you very much. Good night to all of you.
Dr. Bidyut,
Thank you, sir. Vivekananda, you were telling something. Yes, please.
Yeah, Dr. Bidyut, just let me say two things, because I was getting one question from our beloved Dr. Ujjwal Mondolda. I happened to meet him in the surgery clinics when I was in the surgery department during my internship time. Anemia due to chemotherapy, did you use carcinosin or any other? Yes, Dr. Fobister gave the indication of carcinosin in cases of pernicious anemia, but I have never used it as the drug after the chemotherapy, after the patient received chemotherapy. But certainly it is a good point told by Dr. Ujjwal Mondolda. You can think of, or we can think of giving carcinosin in a case of patient who is having chemotherapy or who is undergoing or who has just undergone chemotherapy for any cancer. We can think of carcinosin because this is a drug with the history of anemia, especially the pernicious anemia, as Dr. Fobister told. It is one point. And the second one, Dr. Motin nicely elaborated a case of sexual abuse in the purview of carcinosin and all. This is another strong indication of carcinosin, and I find a very good knowledge of repertory which Dr. Motinda is having. He reads and values repertory very much, which is very essential for a successful practitioner, and he has immense knowledge in that also, which I find from his carcinosin and thyroidinum, the slides, presentations, and all, and the case. And one more point, he told about the insulinum under the rubric acetonuria. This has been added by Dr. George Vitolkas. And in my next session, I would talk about, I would do with the correlation with lachesis and all some other drugs and this thyroidinum and all. There is another very good drug for acetonuria is Sena. This is just a good clinical hint. I have used it. Just 1 minute I am taking. I had a case of a patient whose husband was a railway employee. He was in a top position. He used to come from Barakpur to my Uluberia clinic. So I was fortunate to treat his mother in the deathbed. Also, she called me. Her son called me. Please give some medicine to my mother. So I treated. The case was of a renal failure. It was a case of CRA, chronic renal failure. In the last few months of the case, it was a repeated prescription from my side. I used to prescribe her Sena 6. So Dr. Motinda told very nicely about the acetonuria and insulin. I missed that point. Certainly, thank you, Dr. Motinda. You have raised that particular symptom and the rubric. And after you raised it, I remember the name of the Sena also I used in the case of chronic renal failure and acetonuria.
Regarding the question of Dr. Bidyut Mandal, one thing there is into the Murphy's repertory, there is one chapter, the diseases and condition. So under which probably there is under chemotherapy. So there is the many medicine is given. One is the cadmium salt is given probably into the highest this actually grade. So one can think of this. Thank you, sir.
Yes. Thank you very much. Thank you all. Thank you all.
That's a rare show where sharing of knowledge without conflict of egos and all coming up open-heartedly under the guidelines and Ashirwad of Kalyani sir and the networking of all our juniors, batchmates and seniors. So this is how the NH Alumni Association works. And we'll be having the part 2 of this topic on 11th of May. However, in the next 115th episode, having a very important topic to discuss on, and that will be relating to all the registration related issues, the government NCH registration related issues. So stay tuned. Be a subscriber of NH Alumni Association YouTube channel. It will be there live on Facebook, Instagram, and YouTube. And with this, thanking all to our seniors, pranam to our seniors, love and affection to all the others across the globe. I am returning tonight to our backstage editor, Dr. Orko Mukherjee.
Thank you all. Thank you very much. Thank you all.
Thank you very much.
Thank you all.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, do make sure to give it a like, share, and subscribe. And again, before that, if you want auto-generated e-participation certificate, the issues has been cleared. So you can just go on the link. It is given in the description below. Just click the link and do make sure to just fill up the form correctly and thoroughly. Have a verified email address, and it will the email will be sent. If the auto-generated e-participation certificate is not being generated in your email, please do write us on our email. It will be best for us. And to get more updates regarding this CMEs, just do make sure to join our WhatsApp channel. The link is also in the description. Just go there, check it, and join over there. You will get updated. And also do make sure to subscribe this page, because subscribe our channel, because as soon as we schedule any CME, you will get notified. So again, with this, thank you all. And also, I missed one part. Never, don't forget to like our Facebook page. Those who are watching from Facebook, just like our Facebook page. So with this, let's end today's CME. Until then, we will see. Until then, you guys, we will see in our next CME. It's me, Orko Mukherjee, leaving.